welcome everybody to our daily 11 a.m. press briefing on COVID-19. As is typical, I'll start with a rundown on the numbers. As of right now, we have 3 positive cases, 70 negative cases. Sorry, can you guys hear me? 9 that are pending. They're being tested in the lab today. As a result of our positive cases, we have 2 people on isolation, and we've got an additional 5 people on quarantine right now. We would love to do introductions as per usual, and you all can give us an update on what's happened in the past 24 hours.
Hi there, my name is Mark Mitchelson. I'm the Chief Nursing Officer for Shasta Regional Medical Center. And for updates for us is really just a reminder to the community about our no visitor policy that was implemented at midnight last night. And that a lot of our elective cases, majority of them have been deferred until a later date just to help prevent the spread of this disease. Thank you.
Thank you.
And again, Robert Folden, Chief Operating Officer at Mercy Medical Center here in Reading. Same for us. We did implement our visitor restrictions as of this morning, and we've had great support from the community so far, so thank you for that. And then we also implemented our plan for surgical procedures. So as I mentioned yesterday, we had a team of our medical staff that's worked through some of the different guidelines that have been published, and we have in fact started to move cases that were scheduled for this week and into next. We've postponed those cases that can be postponed. So that'll be the new norm for a little while. And then we want to continue to ask, I'm sure people saw a picture on Facebook yesterday asking people to stay away. And really the intent behind that is if you're a healthy individual and maybe you have flu-like symptoms or you're just feeling under the weather, that's not a time to come to the ER. That's a time to contact your healthcare provider, talk to them over the phone, and then we want to encourage that we also have the ability for folks to access a free, online visit through Amwell. So if you go to our mercy.org website, you'll see a link to information about coronavirus, and then the first story there is how to access this free visit. Thank you.
All right, thank you. And then joining us by Zoom with her social distancing practices, we've got Val from Ayers.
Good morning. Not a lot has changed for us since yesterday. I just wanted to touch on a couple of things. We have been digging deeper into some of our procedures for our skilled nursing facility, just trying to be more prepared in that regard. We still, the no visitors, and primarily really working on educating our staff and the community on the importance of following the governor's order. And just kind of a bright note, since we're always talking about other things, we did implement our grocery program yesterday for our residents of our community within our district. So anyone that is over 65 or has some kind of a health condition that prevents them from getting out to get their groceries, we have a partnership with our local store, and we will be doing their shopping and delivery for them. And we've already had a whole lot of people investigate and take advantage of that. So that's kind of a bright note for us.
All right, thank you so much. And then joining us today is Mr. Joe Ayer with an important message for all of us.
Well, thank you for inviting me and having me. As everybody knows, blood donation is extremely important, and are continuing to need those blood donations to come in. We are encouraging people to make an appointment. That helps with our social distancing. And of course, blood donation is healthy. So a reminder as well is that our needs are going to continue through this whole thing. So if you can't make an appointment in the next week, make an appointment for a couple weeks out.
All right, thank you. Joe was breaking up just a little bit, but his message was, if you are healthy, please come and donate blood. They need it desperately. And call to make an appointment so they can make sure before you come in that you are healthy and well. All right, thank you. Thanks, Joe. Okay. We wanted to remind you to continue to trust reliable sources for your information, including shastaready.org, the CDC, and the State Department of Public Health. You can also follow Shasta County Health and Human Services, and also all of our healthcare partners have presences on Facebook for updates, and 211 is also an excellent place to find resources. And for now, we will open it up to questions from our media.
Oh, there is a microphone person. I'm understanding that this may be the last meeting or one of the last meetings where we are all here physically present. Is this going to move to fully online?
I think we are trying to limit everyone's exposure to other human beings, and so we're looking at, we keep sort of adding more steps to our Zoom as we're getting it dialed in. So I think at some point we're going to want to switch over to that format, but that hasn't happened yet. So.
How's the tracing going for the contacts with the second and third patient?
Okay, that's a great question. I just got an update on that this morning, that the patient's close contacts, of course, were notified immediately, and they're working today to notify that sort of second circle of people. I can give you kind of a quick sort of rundown on how the contact tracing process works if you would like. So what happens is that our public health response team starts with 5 different forms from the CDC to lead them through the process. This is a process that everyone across the nation uses for contact tracing. They ask the patient where they've been and what they've done since the time that they became infected. Usually they take a few steps back from when that person's symptoms began. The closest contacts would be people like household members and anybody who perhaps has spent the night at the person's house. And then they identify close contacts outside of the home, including friends that have been within 6 feet of that person for a prolonged amount of time. That would probably also include coworkers who have been within that proximity to that person. Our public health team reaches out and calls all of those people on the phone, has an in-person conversation with them. They actually do not, because of health protections, HIPAA, they do not say, Carrie Schutte had the COVID virus and you've been in contact with them. They say you have been identified as a close contact. And usually the person says, oh, I know who that was because they called and told me. But we do not identify the person. Then they identify, if they're close contacts, they're told that as of that phone call, they are quarantined and cannot leave their home. That is followed up by a letter from the health officer restating that same thing. They ask if the person has the food, medication, and other things that they need to be at home for that 14-day period. They're nurses, so of course they're wonderful, friendly, helpful people who are trying to make this as easy as possible on the people that are being instructed to stay home. If they don't have someone to help with that, sometimes they can have someone who can drop off their needed prescriptions or food or the other household items they might need. But if not, then we make arrangements to make sure that they do have those things. They stay on quarantine for 14 days since their last exposure to the patient who's been identified as testing positive for the disease. Our nurses check in with them twice a day so that they can report their symptoms and their temperature. And if they do develop symptoms, then we will test them. If their symptoms were bad enough that they ended up needing medical attention, our nurses that have been in contact with them every day, twice a day, would help them make those arrangements to get the health care that they need, because of course we would not want to expose the folks at the hospital unknowingly to the virus. We make sure that they're ready to receive the patient and to help protect that hospital staff. And that's basically how that process works. And has been working. This is a process that certainly is not new to COVID-19. This is, they use contact tracing for all kinds of communicable diseases that occur in our community. So this isn't a new process for us. It's just a new, of course, a new virus.
This is kind of a question, I think, for a medical provider, but if any of you wants to take a shot at it. Is there, I won't say magic number, but we have 3 cases right now. What would the threshold be, given the population of Shasta County, where now it's, oh, this is really going to break loose? Is there a number that we can hold it to, would try to hold it to, that would prevent that from happening? Or, I'm just throwing a number out, 100 people get it now, now it's really going to spread. Is there such a magic number?
Mike, that's a really good question. Brandy, I should have said at the very beginning, I apologize. Brandy Isola, our public health director, and Karen Ramstrom, our health officer, are at there is a Board of Supervisors meeting today that they had to attend. So they're not here with us today. I would say that I don't think that there's a magic number per se. I know that we start bringing on more resources. For example, with the contact tracing, that's something that the people that we have assigned to that task right now can do. There are enough of them to be able to do that, but if we were to end up with more people, we would need to expand our capacity to do things like that. And we are really, really hoping that that stay-at-home order where people are staying home, staying away from others is helping us to keep that number down.
And then, there's a saying in the military that failure to plan is planning to fail, right? So part of our operations, part of what we do together, SRMC, Mayor's Memorial, the county, we're all working together on the what ifs. And we've been talking about this for the last 2 weeks, that behind the scenes, even though we only have a few cases here in Shasta County, clearly we see what's occurring across the nation. We see what's occurring in Sacramento or Santa Clara or San Francisco. So we look at that information and then we ask ourselves, what do we need to do if and when? And that's part of the surge planning that we've been talking about. So all of us have different levels of plans that we would implement. And that could be as simple as, I need another tent on my ER deck to act as a lobby. Or that could mean, gosh, we have several patients that are needing hospitalization. Maybe I should put them in one consolidated area where we conserve our protective equipment, we leverage similar resources. So know that behind the scenes, we continue to plan, and there's this little mystique that if we don't plan, something will actually happen. So the more we plan, the less likely it is to truly impact us. So I hope the public out there knows that we continue to plan for lots of contingencies, hoping that none of them come true. We're fortunate that we're a rural community. We're fortunate that we're somewhat isolated from larger population centers. So, my hope, what I tell my family, is I hope that if we practice social distancing, if we wash our hands well, if we're cautious during this time period, it shouldn't impact us like a large metropolitan area. Are we ready? I look at the folks in front of you. I'd say we're as ready as we can be. And the same thing goes for protective equipment. I'll turn the mic over to my partners here, but the question continues to be asked about, do we have enough protective equipment? And our answer is likely going to be, based on our current operations, I think we're all doing pretty good with our protective equipment. The one piece that many of us are lacking on are the small N95 masks. Well, in the last few days, PG&E has donated some masks, OES has released some masks, so we've gotten our small N95 mask orders sort of filled, if you will. The challenge would be if we started seeing a bunch of or many sick patients coming into the hospital and truly needing to be isolated and hospitalized. That's when we're going to start running through a lot of this equipment that we don't normally run through on a day-to-day basis. And that's why all of us are monitoring our supply levels on a daily basis, literally, to make sure that we're ready.
You mentioned masks. Some people are sewing masks. Are those effective at all?
Hi.
Oh, sorry. You mentioned masks, and some people are sewing masks. Are those effective?
So I'm not an expert on that. I know that there are many parts of the country where they don't have access to N95 masks. They've run out of other supplies. So You know, when we talk about conservation and we talk about the depletion of resources, then we turn to what's the next best alternative. I know that we're discussing the use of cloth masks here in Reading. I know that there are many people in the community. You know, the beautiful thing about Shasta County and Reading is that you have so many people who want to do. They want to help. They want to fill a need. And I think there's a place for all of that. I'm not sure our need is there yet, but we want to work with those agencies, and maybe we can even help where there are critical supply shortages, where an entity here in Reading might help someone outside of the community. And I'll turn it over to my other partners here.
Also, I should have mentioned earlier, we had a Facebook person mention yesterday that they would love it if you would reintroduce yourself when you're, so they know who's talking before you talk. So we'll do that from now on.
So I thought he actually mentioned everything very well. One thing I would say is, once again, we would love for the community to work with us around supplies and other communication type tools. Of course, we will never say no to anything that the community decides to provide, but we just want to make sure it's done in a methodical way so we don't have somebody just dropping a box off at our lobby. Really work with our community partners, go to our websites and talk to our marketing teams to make sure that any contribution really is done methodically. Thank you.
Thank you. Val, did you want to add to that?
I would just follow up with the fact that, yes, we have been working for a very long time to prepare for different situations that may come upon us. And there was a point probably early in my position here that you think, am I doing this work for nothing? Because there's a lot of requirements that are put on us by CMS and the state for emergency preparedness. And now looking back, we just see how important it is that you go through all those steps and that you have plans in place. And really, we're as prepared as we can be. And we keep looking at all of the different systems and how can we make it better. And we're very fortunate to have a coalition of other emergency preparedness coordinators that we work with, and we share ideas, and we have support outside of our community. And then addressing the PPE, we also have been conserving and using it very discretionally, and we need to protect our staff. And we've had a couple of community members donate some things, and we too are open to those kind of donations.
All right, thank you.
My question is a lot like Mike's previous question, but I like Mike, so I'll ask. It's from, and I'm not sure it's answerable, but from an epidemiology point of view, how many cases would there have to be before you'd be able to predict where the exponential growth would be, considering it's a 2-week out period from infection to possible showing of symptoms? How many cases would there be before it would be mathematically possible to predict the exponential growth of it?
That's a great question. Thank you, Steve. We, as luck would have it, we do have epidemiologists working on that very question right now. They're still in the process of trying to figure all of those things out. Because this is a new virus, it's not as easy as it is sometimes with the flu, where we can say, oh, this is going to be a really terrible flu season because, based on projections and things like that. We don't know as much about this virus as we do about any other diseases that are in our community right now. So it's a little bit trickier, and we've got a lot of epidemiologists throughout the state putting their heads together to try and get an answer to that question. It's an important question that we're trying to nail down right now. And we'll definitely share that information as soon as we have some more concrete numbers on that.
Update on the 70-year-old woman and 40-year-old man. Can you give us any update on their condition?
I know that the woman in her 70s is hospitalized still. I do not know. I don't have an update on her condition. I'm not sure if anyone else does. The person, the man in his 40s who was the close contact of her who was tested positive yesterday, his symptoms right now are such that he is able to be at home.
Will Shasta County be releasing a list of places where these individuals have been publicly?
So as part of the contact tracing process, they do ask when and where those folks have been. As of this moment, there is, we do not, let me start over. Let me think that sentence all the way through. At this time, we are not aware that there is any specific place where people would have been exposed to the virus and therefore need to, be concerned about symptoms. What we would reiterate for sure is that because there is limited testing in our nation, we do want people to assume that the people around them have the virus and protect themselves accordingly. Washing hands, staying home, all of those different things are going to help protect all of us. If there does become a need where there is a place that we need people to know, if you've been here, you need to watch out for these symptoms, we absolutely would send out a news advisory press release and also share in these briefings. We would not keep those things secret.
That's what I was going to ask. Like, if you knew one of these patients when they were at their very contagious point, if you knew that she spent some time in a bookstore looking at a particular section of the books, for example, or at a store spending some time in some corner of a store, you'd be able to release that information?
We are reliant on our public health nurses and our medical professionals to let us know if the public has been at risk at any point by being in a specific location, any more than they might be today, knowing that there are certainly people who probably have the virus now that we just don't know.
Is there a concern that that sort of information would prompt a run on people wanting or demanding a test, thinking they're sick, because they'd say, oh God, I spent a lot of time there too? In light of the fact that there aren't a lot of tests available, would that be a concern?
We would say the same thing that we've been saying for the past few weeks, which is if you have mild to moderate symptoms that are similar to the symptoms that are characteristic of COVID-19, act as if you have it and stay home, isolate yourself, wash your hands. As you know, there's not a treatment or a vaccine for the disease. So if you don't need to be in the emergency room to be hospitalized, I know people don't love this answer, but this is the answer, and it's that we want people to stay home, wash their hands, stay away from people as much as possible so that they do not either contract or inadvertently spread the virus.
Understanding that there are limited tests available, can you explain and maybe clarify the algorithm and the prioritization of who gets tested and maybe who wouldn't get tested?
Sure. So our public health lab tests the most at-risk people, and those are people who've had exposure to a case of COVID-19, travel history that indicates risk, hospitalization with symptoms with no other known causes, employment as a healthcare worker with symptoms with no other known causes, and other situations if testing is deemed to be necessary for the control of communicable disease. Those are also, the people also have symptoms. That would be another reason that we would need to test. So those tests would come to the Shasta County Public Health Lab. Other people can be tested. If your healthcare provider calls public health and says, I have this person and gosh, they're terribly sick and I really think that we need to test them and they don't fit into these criteria, public health will say, you can go ahead and refer those folks to a private laboratory, and those labs are doing testing as well. Did you guys have anything to add to that? Okay.
first respond, I imagine first they would probably fit into healthcare workers. I'm not totally certain. I would probably be on it. Right now, we have such a small number that it's sort of on a, we discuss case by case, so.
Do you have any recommendations for individuals who may have been in areas with widespread community transmission, who are coming back to Shasta County?
You're probably going to be really surprised by my answer, which is please stay home, wash your hands, isolate yourself from other human beings, stay 6 feet away from everyone. If you have come from an area with community transmission where you know that you're at even higher risk than those of us who are just hanging out in Shasta County in our homes like we're supposed to be, then you can self-quarantine for 14 days. That would be recommended. These questions, by the way, Jill's not an audience plant. She's helping to monitor our Facebook feed, and so when people ask questions on Facebook, she's asking them. She's not just making up things to make me say the same thing over and over.
But I do have another one.
Okay.
Have the local hospitals seen a noticeable uptick in bilateral pneumonia?
No for both facilities at this time.
Val?
Well, I didn't hear the question completely.
Have you guys seen an increase in bilateral pneumonia in your hospitals?
No.
Okay. That was a very specific question. Anything else? Okay, well, again, I want to thank all of you for playing the important role that you play in helping us get the news out to the people. If you have any questions, you know where to find us. And as of right now, we will be right here tomorrow at 11 a.m.